So as immunotherapies become more mainstream, the question is, how are community physicians being able to use these agents, and how do you pick the ideal patient for immunotherapy? And I think it is becoming more common, and I think the big change was really the breakthroughs that happened in lung cancer. So whereas melanoma may be a disease that many community oncologists don't see a lot of, and we're comfortable sending them to the larger academic centers, lung cancer is a much broader problem. And in many cases, these are patients that can't travel to academic centers and make up a much larger part of a typical community practice. I think the community is really stepping up, and I think that they are, in fact, using the checkpoint inhibitors with greater ease in the community. I think they're learning how to best select patients and how to, perhaps more importantly, take care of the potential side effects that can occur with these drugs. In general, the immunotherapy drugs, especially when they're given in combination, can be associated with significant toxicity. So really taking a careful look at the patient's performance status and general other medical comorbidities is important. Having said that, some of the single-agent PD-1 agents are associated with a rather favorable toxicity profile. You can get into some serious adverse effects, but the likelihood of this is a little bit lower than with the combinations. So while I think these really demand a lot of attention and the patients on these agents have to be watched carefully, I think they can be safely given in the community setting. What's important to know in assessing the response to immunotherapy drugs? So there are a few things that we have to really think about. So first of all, the kinetics of the response can be a little bit different than what we see with other cytotoxic agents. So if you think about immunotherapy drugs as not acting directly on the cancer cell, but indirectly through generating an immune response, it's not an unusual outcome that it may take a little bit longer to see a response. So sometimes with immunotherapy drugs, we do have to treat patients a little bit longer than we would normally expect to. And there has been this phenomenon of pseudo progression, where it looks like a tumor may be growing, but it's really an inflammatory response to the treatment. And so we continue to treat patients even in the face of expanding tumor. I think it's important to understand that this is a pretty rare phenomenon. So it's more common with certain of the agents. So for example, we're more likely to see this kind of pseudoprogression with ipilimumab. We've seen it in a fair number of patients treated with oncolytic viruses. But with the PD-1 and PD-L1 agents, which are in common use, seeing true pseudoprogression is extremely rare. So I think when we see a patient who has a tumor that looks like it's progressed, it's really important to make sure that we're not dealing with disease progression. And so some of the clues we have to that is the overall well-being of the patient, the general performance status. Sometimes there may be tumor markers. So in the case of melanoma, we follow serum LDH quite frequently. And in patients who have true pseudoprogression that are having a good response, we typically will see that the LDH is going down, which is in contrast to patients who have true disease progression where the LDH may often go up. So I think this requires very careful clinical evaluation of patients. And when patients just don't look good, I don't think it's safe to assume that it's pseudoprogression. I think the onus is on us as the healthcare providers to really prove that the disease has not progressed. In some cancers like melanoma, PET scan has been particularly useful because in cases of pseudoprogression, the metabolic activity of the tumor may go down before the CAT scan clearance of tumor will be seen, and it can be used. But it's really highly dependent on the tumor. Some cancers, for example, renal cell, don't take up the PET material very well, and so it's less reliable in those patients.